Hi everyone, this is Dr. Thomas Bartell, board certified plastic surgeon specializing in body recontouring surgery. And today I was going to take a step back and reintroduce myself for anyone who really doesn't know who I am or what I do. As I said, I'm a board certified plastic surgeon. What that means is I've completed a residency in plastic surgery and passed the board exams, and I've been practicing, solo practice in plastic surgery for almost about 30 years now. Now, when you start off with plastic surgery, I was trained to do everything in plastic surgery, everything from cleft lips and palates to complex reconstructions to hand surgery, and of course, cosmetic surgery. But over the years, I tended to drift more towards the cosmetic body recontouring and specialize just in those procedures. And I'll tell you why. Really, two reasons. One, those are the procedures I really enjoyed doing the most. And two, those are the ones I was the best at. Not just the best personally, but the best of any of the other surgeons around that I felt. I gave up the procedures that I thought there were other surgeons who did the operations better. But the ones that I do, I think I'm really the best at. And that's why I enjoy doing them so much. And I've been practicing here in the Madison area since, I think it's about 1992 now. So I've been around for a while. I think women and even some men will come to my practice for a number of reasons. One is that it's a very private clinic. Although we're a fully accredited surgery center here, we're still a little private. You don't have to worry about being a small fish in a big pond. They come to me because of my experience. I've been around a long time. I've probably got the most gray hair now of any of the plastic surgeons around, so that's why they come to see me. And a lot of times they will tell me, patients will tell me, they come because of my team. I've got the greatest team out there, both the clinical side and the operating room side. All of my folks are really the very best, and they take really good care of me. Now, the operation that I tend to do the most of now these days is a breast augmentation, and I do an awful lot of these, and I've been doing an awful lot of them for many years. I really specialize in that operation, and because of the number that I do in any given year, I think it's very likely that I've done more of these than just about everyone else out there. People come to me for their breast augmentation for a number of reasons. Obviously, my experience. But I'm also the only surgeon in this area that routinely performs breast augmentation with no scars on the chest. Other doctors may claim that they do the operation, but if they do at all, it's very rarely. And they'll all put a scar on your chest. I never do that. I do this through a tiny little incision in your armpit, and eventually I can't even find that scar. So, women can get a good breast augmentation a lot of places, but they'll get a great breast augmentation here, and it will have no scars at all. The other reason that women tend to come to me is because I am the only one who can offer the newest breast implant called the Ideal implant. This is the implant that has the feel, the performance of silicone, yet the safety of saline. And it is adjustable. Unlike a silicone implant, it's adjustable in the operating room, so it gives me the most latitude to give women the best result possible. I'm the only surgeon in this area who uses the Ideal implant, and I've been using them a lot, and a lot more recently. Now, when it comes to my practice, the first thing we do is we talk about what the implant options are and why I only use saline implants, and I've always only used saline implants because of their safety and the fact that they're adjustable and so forth. And then usually we end up talking about size, how best to size a patient. There have been lots of different techniques over the years. Some doctors give patients prosthetic implants and have them put it in their bra, or some women will take baggies of rice and so forth. None of that seems to work for me. What works best for me are my books. I have books of extensive numbers of patients, befores and afters. We find before pictures that look the most like my patient, and then she looks at the after, decides if that's what she wants. She wants to be a little bigger, a little smaller. Having known exactly what size implant I used in the book patient, I know exactly what size implant that will get my new patient the exact results that she wants. This is the technique that works for me, and it lets me hit the mark. That way I get a lot of happy patients. And very, very seldom do I ever have a patient who says, I love them, doc, but I wish I'd gone a little bigger. I just don't hear that very often. So I began offering the ideal implant many years ago because the regular saline implants, the only problem that I saw that they would have is on very thin women. Occasionally I would get a patient who you could actually feel the edge of the implant, the ripples on the sides. And until we had the ideal implant, we really didn't have an answer for that. Except I would tell patients to eat more Butterburgers, but no one wants to do that. But then the implant, the saline ideal implant came out, and here now we have an implant that minimizes rippling. That's why I was offering that to the thin ladies because I felt that would address their problem. That was until last year. Last year, a study result came out that showed that the ideal implant actually has the lowest complication rate of any of the implants out there, silicone or saline, with regard to capsular contracture, with regard to rupture rate. It was just a superior product. So lately, I've actually been putting in more ideal implants than anything else. And there may well come a time when that's be the only implant that I use, because I think it's just a much better product. And if you're only going to do this operation once, you want to do it right. So that's why I use ideal implants. And lately, a lot of women come in actually asking for it. They're doing their research. They're going out there and they're finding out on their own what is the best product out there and which is the best way, techniques to do the operation. That's why I do so many of these. Now the downside is you may have to wait a few weeks before you get your surgery done because I'm really busy. This is my busy season. So you have to try to get in. If you have a date in mind, get in to see me early. So that's kind of how it works. Gosh, I have a lot of happy patients, especially with these ideal implants. And it's great to be able to make patients, a lot happier with their body image, a lot happier with their lives. So anyway, that's me. Thomas Bartell. See you next time.